We have been talking about the pelvic floor, and after yesterday's video where I was showing some techniques to work on the pelvic floor, I realized that a lot of people do not know that pelvic floor therapy is a thing. Now, pelvic floor therapy can be done externally or it can be done internally. Both men and women have a pelvic floor. A pelvic floor is this right here, is all of this muscular girdle that sits in the bottom of the pelvis. Our pelvis has a giant hole in the bottom. And so if you did not have this muscular girdle, whenever you went to bear down, say you're using the bathroom, your insides, all of your intestines, your vital organs would be compressed out the bottom of your pelvis. That's what a prolapse is. The pelvic girdle is composed of muscle, which means that it can spasm, it can cramp, there can be odd sensations, pain, there can be pelvic floor dysfunction. And that is what we're talking about when we say pelvic floor therapy. Women tend to have more of a problem with it just because there's birth involved for a lot of them. There are pregnancy, stuff like that. There's more going on in the female pelvis. But there are things that can happen to males as well that can cause pelvic floor issues. I will throw up some labels here so you can kind of tell what's going on. Glute max is going to be this big muscle there, just your butt cheek. The big yellow nerve here is the sciatic nerve. So we're going to be talking about this for a little bit because it's just an interesting area and obviously a spot where we need to do some teaching because there's a lot of people who had no idea what this was.